we will be left with horror stories, because the broken system is going to continue to produce horror stories.
As the heart-wrenching story unfolds, hospitals officials respond with explanations, but the underlying challenges remain stark. Despite heartbreaking scenes and desperate pleas, hospital officials at Mapen Hospital struggled to explain why a newborn tragically lost its life due to the absence of a ventilator. This incident is just a glimpse into the larger systemic issues plaguing Jamaica's healthcare system. Shavani Farkinson Blackstock, a nursing student, watched helplessly as her newborn struggled for life. The doctors and nurses did everything they could, but without essential medical equipment, their efforts were in vain.
Sharon Bailey Farquharson believes it's unacceptable that a hospital should be without the right resources to carry out its function. But what was the challenge they found causing the baby's unexpected death?
No ventilator to put the baby on. This is really bad. This is really poor. My daughter had been tearing apart, and on top of it, she have an elevated pressure, and she's swollen, hands are swollen, feet are swollen, and all of that. And she stand there and you know, watch her son took that last breath for her mother.
This tragedy highlights a severe lack of resources in our hospitals. Resources that are critical for saving lives but are often missing due to systemic mismanagement and corruption. Over the past decade, nearly 700 billion in public funds allocated to the Ministry of Health remains unaccounted for. Reports from the Auditor General highlight numerous cases of overpayments, missing equipment, and unapproved contracts. These mismanagement issues have direct consequences. Despite initiatives like the Program for the Reduction of Maternal and Child Mortality, PROMAC, Jamaica's maternal and mortality rate has soared. From 96.4 per 100,000 live births in 2017 to 156.7 in 2022. The numbers paint a grim picture. The director of the Pan American Health Organization, Dr. Jarbas Barbosa, recently called for urgent action to reduce maternal mortality in the Caribbean. He highlighted that the COVID-19 pandemic has exacerbated existing inequalities, with maternal mortality in the Americas increasing by 15% between 2016 and 2020. Barbosa emphasized the need for universal access to quality maternal care, noting that 9 out of 10 maternal deaths could be prevented with the right interventions. He urged governments to expand primary healthcare systems to ensure universal health access and coverage. Despite these calls to action, the Jamaican government has been slow to respond. Activists like Jeanette Calder from the Jamaican Accountability Meter Portal demand accountability from the health officials and call for an end to decades of negligence and corruption. As we uncover the truth behind these tragedies, it is clear that immediate action is needed. We must demand transparency and accountability to ensure that every Jamaican receives the quality health care they deserve. Join us in demanding justice for Shavani and all families affected by the systemic failures. Share their stories, raise awareness, and together, let's ensure a better future for Jamaica's healthcare. Thank you for watching. Please subscribe, share this video, and let's make a difference together.